Dunroven first opened or was being built, we lobbied for a space for 6 people who could be housed in a special place with specially trained nurses, with a quieter atmosphere.
Our major function probably is to assist the people that are here in the hospice, the staff, and our grief counselor and our executive secretary. And we do a lot of fundraising over the year in order to provide the funds that are needed to help support this unit.
We have education sessions where we bring people with expert knowledge on palliative care and grief recovery into the community so that we can help educate the staff of the hospital and home care and the unit here in Dunroven.
We spend a lot of time raising money and helping support the staff here. With what Carol mentioned, we did here just a learning session for all the medical staff and the public so that people were aware of what hospices is and what's provided for them, and for the medical staff to give them some training to help with the clients, to give the clients support.
We, of course, raise a lot of funds, and out of those funds we're able to buy special mattresses for the hospital. We used to buy beds for people at home that needed more than what their bed would be at home. And we certainly have, through the help of many people in this community, have furnished this unit. I'm quite excited about the special beds that we had, because that's something that is comfort measures for people. It's really nice when you can't get out of bed to be able to have something that will put you in different positions, and so you don't have one pressure on one spot.
We have a grief counselor that is available to everybody in the Quesnel area, which would include NASCO, Wells, and she's available to offer support and counseling for families that are dealing with grief and the loss of a loved one. And she's also our volunteer coordinator, and she's always looking for volunteers to help support people that are palliative. And they can go into the home, they go into the hospital, they come in here to the hospice, and she's always looking for it. And I believe it's a 32-hour training session that she provides that you need in order to be one of the volunteers. But we're also looking for volunteers that would be willing to help us with our gala, our hike for hospice, any of the events that we have during the year. We have our Hearts for Hospice auction and gala coming up on February 3rd. And it's one of our major fundraising events. There'll be an auction, there'll be lots of fun. There's a dinner that goes along with it. And then we have in May, we have Hike for Hospice, which is another one of our fundraisers.
The people of Quesnel are fortunate to have this unit. There is no other unit in Northern Health except for Prince George, who has an actual private hospice.